Okay. I have a little disclaimers to do. I know you've heard this before, but I am legally obligated to do it again. So this information presented during the session is not medical nor legal advice, nor is it intended to be substitute for medical or legal advice, diagnosis, or treatment. Always seek the advice of your physician and or attorney or other qualified health provider with questions concerning a medical condition. Immune Deficiency Foundation, IDF, educational events offer a wide array of presentations, including content developed by healthcare and life management professionals. The views and opinions expressed by the guest speakers do not necessarily reflect the views and opinions of IDF. So I want to welcome our panel members. We have Vicki Metal, and then we have Rachel Wagner, we have Lance McCall, and we have Carissa Marsden. And I'm going to allow them to tell a little bit about themselves. So your mics on the table work, and then and then Carissa has a mic. We're going to start with Vicki.
Okay, start. Okay. Hi everyone, I'm Victoria Metal. I'm 20 years old. I'm from New Jersey. I was diagnosed with an unspecified PI when I was 14, and as of last year, I do not have a formal diagnosis anymore, and I'm off of IG treatment. I'm also going into my senior year at Rutgers University on the pre-med track, and I'm hoping to apply to medical school in 2025.
Vicki is also one of the stars of our documentary, Uncompromised. Or Compromised.
Yes.
Compromise. We also have a wonderful podcast called Undiagnosed, and I love that podcast. Shout out to the podcast.
Okay. Hi, I'm Rachel Wagner. I'm 17. I live in Louisiana, and I have CVID. I have no IgA at all, and I was on sub-Q for a little bit with Hizentra. Didn't really work well for me. So I switched back to IVIG with GammaGuard.
Okay, and Lance.
So I'm Lance. I'm from Florida. I'm 24. I was diagnosed at birth with CVID. I have been through several products. I have no IgG and no IgA. I've also lost my hearing from this disease, but it's all good.
Lance, we're going to have to talk a little more into the mic. So that, because this session is being verbally recorded, so that those that could not attend here tonight can get a podcast version of this. So I just want to remind all the panelists to make sure that you speak into the mic and as loudly as you can.
He said, I'm Lance and I'm awesome.
He did say that.
I'm Carissa Marsden. I'm much older than all of these sweet people, and I don't want to say my age. I have CVID and was diagnosed from a young age and from Houston, Texas.
So this is your panel for this lovely topic, Immune to Limits, Thriving in Academics with PI. So give them a round of applause. And if it wasn't for the pesky stage, Lance would have nailed that. Okay. So we're going to start off. This is going to be a very casual conversation. So as a matter of fact, there's so many people that are like kind of spread out. If you feel it, you can move up a little closer so that we can just have a little bit more of a conversation. Because we are not only interested in what the panelists have to say about this experience, we also want to hear what your experiences are thriving in your academic life. So we're going to start off the conversation with school woes. So two of the main things that you all talked to me about when we were brainstorming this session is catching up and difficulty concentrating. So I'm just going to open it up to the panel, and whoever wants to offer their expertise on this can just do so. So tell me what it means. What does catching up mean to you all? What does it mean catching up? So, what you guys talked to me about was catching up on missed work, because illnesses can be overwhelming. They can hit whenever, and then you end up missing like half the school year, right? Or you start missing enough where they start getting involved. So what does that look like? What has that looked like for you all, and how have you all dealt with that part?
I can say personally, as far as catching up goes, it usually almost like it starts out, you feel like you're drowning. You feel like you have all this work that is just accumulated up and it's just built in, it's just crushed you. But at the end of the day, it's always the way I've dealt with it is, if I knew in advance, hey, I'm going to have a doctor's appointment, I've tried to communicate with my professor or my teacher and been like, is there any way I can do this at a later date? I can have an extension. Make sure you always try your best to communicate with them because they're people too and they understand that maybe sometimes everybody has a little problem and if you can really relate that to them, they're usually a lot more understanding. So.
I know for me in high school, I ended up doing Florida Virtual School because that became easier for me to stay caught up or less having to catch up because I was able to take my work to the hospital with me or to my doctors or do it in the car if I had a long road trip. As far as college goes, looking at the syllabus, a lot of times which for those that aren't in college yet, the syllabus kind of outlines your entire semester. And that's a good way to kind of keep in track of what's on each week. And then you can, from there, kind of plan your time around what the assignments need. And thankfully in college, you kind of learn, okay, this type of assignment takes this long, that takes that long. And you kind of just pick your time between your day. And for me, I also found that it was really important that I plan my day in my calendar and I stick to it. Because then when an alarm went off, I was like, okay, what am I doing next? And oftentimes it was changing the subject or take a break or go snack or something. Staying hydrated is also very important when catching up because you can get caught into the rut of just doing the work that you then deplete your own body and then you make yourself sicker. Then your work decreases, your grade decreases, and you have more work to do.
That's a very important tip that you bring up is always take care of yourself. Don't throw self-care out the window because we love to do self-care until it gets stressful, and then that's the first thing we throw out the window.
I like to say self-care is the first thing to do to help keep you from getting sick or getting worse because improper self-care will only make matters worse.
Very good point. Vicki?
Sure. Yeah, for me, especially when I was in high school, I made it a constant effort to be very open and keep my my teachers and my professors up to date with everything that was going on, asking for extensions on assignments or asking if I would be able to make this up. And for those that weren't as understanding, I definitely fought for a 504 plan. And when I went into college, I spoke with my disability advisor. And you can just reach out to the Office of Disability Services at any college that you attend. And usually they will be very accommodating. They'll require a couple of documents, written letters from your physicians regarding your condition and your limitations with schoolwork. And that has really helped me stay on track with everything. It's given me extensions on assignments, leeway when it comes to class attendance and things of that nature, which if you don't have the pressure or the pressure of deadlines, especially when you're not feeling well, it definitely helps you be a little bit more intentional with your time as well.
So I heard a lot of communication is key. Make sure you're communicating with your teachers about upcoming medical appointments as well as just how you're feeling and self-care. Anything else you want to add there?
To go off of Vicki, the other thing is to remember that you, as a person with a disability in this condition, do have rights, even if your teachers or your professors are like, yeah, no, if I do give it to one person, I have to give it to all. That's not necessarily the truth. And if you have the documentation and the support of the disability or your doctors to back it up, they legally have an obligation to accommodate you in an appropriate manner and help you. And sometimes you do have to remind them, you're here to help me with my education. I'm not here to help you with your paycheck. Which comes down to it, but even as middle school, high schoolers, speak up, learn to advocate for yourself, learn to go up to your professor and be like, what you're doing is not what's wrong, and I know I have a right to have an accommodation. Sometimes they're able to change some of the work and kind of combines some of the work to make the assignment quantity less, but you still get the quality of the education in it. And if you're really having issues with something, go to your doctor, get another note, and give it to the school. Don't let an adult or a teacher who's in charge of your education deplete your education because of their own ego and their lack of wanting to accommodate accordingly.
Or even just their lack of understanding the complete.
Sometimes you do have to educate them too.
Right, because not everyone knows what falls underneath the ADA rights, especially in terms of educational rights. And so for the parents who are in the room, I would definitely do your best to get very acquainted with ADA and educational rights and 504s and IEPs and IFSPs because they will help your child to get the accommodations that they will need to be their most successful self. So I'm going to throw this question out to the audience. So anybody in the audience have anything to share about how they themselves deal with or thrive in terms of catching up when they've had to miss so many days from school and they just need to catch up? Hey, Elena.
Yeah, I recently had this experience. In May, I was out for a week, and I was in and out of the hospital that week. And I had tons of missing assignments, so what helped me was, like, I kind of handwrit a plan and, like, okay, this is what I want to focus on getting done first. This is what I'm going to do after that, and then this is how I'm going to do it. And then also, like, talking with your school counselor to help make teachers realize, like, that I'm going to need more time on those assignments and things that were, like, currently going on, because making up missed assignments also affected how I got current assignments done.
Thank you, Elena. Does anybody else want to add anything in regards to how...
Hey, Kat, real quick. Another thing to go off of kind of what she said is sometimes it can help if you know that you have these assignments to write the plan out and go to your teacher, your professor, and be like, here's my plan to get caught up. Because a lot of times they can be hesitant because they're not sure if you're trying to take an easy way out even though you're not. And if you're saying, okay, look, I know I'm out, here's the assignments, here's how I plan to catch up, and then if something happens, you have a doctor's appointment, you feel bad, you're like, hey, this just didn't work out because, and you give them documentation, they know you're actually trying and you're not just trying to get an excuse out of it, and that often helps to show them that you are actively trying to catch up and do the work and not just go by without it.
Show the initiative.
I'm Ollie, and I have CVID, and COVID for me started in 3rd grade, so we left the school early in 3rd grade in like March, and then for 4th grade, everybody else was like going back to school with their little shields and stuff, but that wasn't the case for me. I just had to go full online that whole year for my safety, and it was really hard because I wasn't there, and I'm more of like a interactive learner, so being in the classroom was really hard. So I was like falling behind really. So I just had to communicate with my teachers so they can give me some like extra pointers and maybe have like a one-on-one session with me. So.
Thank you for sharing, Ollie. So one thing that I definitely hear a lot about or one theme that I'm hearing a lot is communication. Communicating with your teachers, even with your doctors, and your guidance counselors and your support system within the school, to let them know what's going on so that they can better support you.
I'm Belle. I have CVID. During COVID, I was the opposite of Ollie. I actually thrived, and like it was really good. And then when I had similar teachers, like I had the same teachers when I went back to school in person, I struggled really bad, and so they were like, "What's going on?" And I had to like explain to them. And some of them were like super like understanding, and others were like, "No, you can't do this. No, you can't do that." And it was kind of frustrating. But after like advocating for myself, it was really helpful. And something my mom did was she wrote like basically a letter of like things that I struggle with that I could give to my teachers so they could help understand what's going on.
Thank you, Bill. You brought up one of my favorite words, which is advocate. So you have to advocate for yourself. Parents, you have to advocate for your kids. But kids, you have to advocate for yourself. Something that I will piggyback on what Lance said is, so sometimes adults do this thing where we're like, hey, we're adults, so we have authority, and we can, tell you what to do. And a lot of times the adults in your life have the best intentions. However, not everyone, kind of goes back to that, not everyone is familiar with educational rights, not everyone is familiar with the American Disabilities Act, the ADA, and so they may be advising you in a manner that they are not fully aware of. So they may think that they cannot accommodate you in such a way, but they really can. So advocate for yourself. Don't always let an adult say no. Always be respectful. But don't let no always be the end.
Also remember you can advocate alongside your parent, and that can go further too when you're both advocating for you, because you'll both have one goal against one problem, and your parent can help you with some of the verbiage to use to advocate for yourself, but sometimes parents can keep advocating over us, and it kind of foreshadows us, and then we get kind of stuck in a rut and we don't want to advocate for ourselves. But it's really important that you collaborate as a team against the problem.
Hey, hi, my name is Victor. I'm actually Victoria's brother, and I don't have PI, but last year I was a senior in high school, and I actually had kind of a similar experience about missing work. So I missed a fair number of days due to I don't have PI again, so it was unrelated to anything immune. And also, quite frankly, my teacher sucked. I was in a lot of AP classes. I was in 5 AP classes, and a lot of my teachers would just present slides, and they'd run through the slides so fast that there was no learning to be done, because you just couldn't comprehend the information that quickly. So I had to end up learning most of it at home. So it was like I really had never even gone to school for some of those classes. So I just want to give maybe some tips as to like when you're studying, like how I did it, and maybe this could help some other people. So when I was studying, I found it very important to write down what I was going to study that day and what homework I had to do. And then I did it on an online calendar, so once I was done, I could just check it off, and then I knew that I didn't have to worry about that anymore. And I also decided to work in 1-hour blocks. So I'd work on like one subject for 1 hour. Then I'd actually set a timer on my phone, and then I'd take a 5-minute break just to rejuvenate myself. And that was more than enough to just, once that break was over, you could jump right back in, and then your brain didn't get as tired, so you were able to really maintain focus for a longer period of time. So yeah, that's what really helped me get through that. So
Thank you, Victor. That 1 hour to study and then take a break. The process is called Pomodoro. It's actually like a technique. It's a studying technique called Pomodoro because the guy used a tomato timer. He was Italian, and Pomodoro is how you say tomato in Italian. But it's a great little work hack. It's a great study hack. I used it myself for work. Okay, we're going to move on to the next one. Missed school and falling behind, frequent illnesses. They can spread very quickly in crowded high schools, as well as treatments and appointments. They can take time and require missing school. So these are other things that, do you all agree that you should communicate with your teachers and counselors about when these things are happening or how you are feeling? Do you have anything else that you want to elaborate upon or add to this topic?
So for me, I found it was really helpful during the frequent high illness signs that, one, wear a mask because it's going to protect you and others' opinions are irrelevant for the most part. And two, to have a thing of Lysol or alcohol wipes and wipe down your desk, wipe down the things that you're going to spend a lot of time touching, and that can cut down on the transmission of those frequent illnesses that you can catch very easily, and that can help reduce your likelihood of getting it. And sometimes I would even just ask my teacher, hey, can I sit in the back of the class today in the corner? Just give yourself some distance, kind of create your own space that people aren't touching everything in. Use your own pencils, use your own pens, don't share, and that can really help you protect yourself. But that goes back to communicating with your teacher about your needs, your feelings, and what you feel you need to be successful in that day of school.
Very true. Thank you, Lance. Anybody else have anything else that they want to add, either from the panel or from the audience?
I definitely agree with Lance as far as bringing your own items. I know sometimes as far as maybe computers or technology goes, it can be hard to get your own items for school, but definitely kind of try to keep your own pencils, keep your own personal items. And I know especially if you're in high school or middle school, people are always going to be like, hey, can I borrow that? Hey, can I use that? And you never want to be that guy where you're like, no, you can't touch my stuff. This is mine, and I don't have to tell you why you can't use it.
Be that guy.
But I know, but like, be that guy. So what I kind of always had resorted to doing was like maybe like bringing like a pack of like cheaper pencils or like cheaper pens in my bag where I'm like, yeah, sure, you can have one, just not the one I'm using. And so where you can still kind of accommodate other people and be that nice person without having to put your illness out there. And as far as Ollie said with his online classes and how they were a little bit harder, I would always try to push for that one-on-one and kind of going in advance and being like, hey, I noticed I have a test coming up. I have an appointment on Wednesday. Is there any possible way I could probably take this on Tuesday? Or if I could stay a little later that afternoon and do it, or you sit in the library and proctor me. So I definitely agree that as far as advocating for yourself goes, I've experienced this since I'm in online college now. In person is definitely better, but like Lance said earlier, just because they're your authority figure, it never means they're your dictator. It never means just because they said no, it means no. Like he said, you have rights as a person with PI and as a person with an illness. So there's always going to be someone above them. And if need be, take your parent, go yourself, and be like, hey, I really appreciate your university, your school, everything I'm doing and learning here, but I feel like there's some gaps and things that I need to be done that I'd really like to discuss with you. And I promise they will almost always be willing to hear you out. Even if they don't agree with you, they will at least listen.
I really love the idea of like a community a box where you're like, these are the things I will share, but these are my preciouses, and I cannot share my precious with you. I like that idea.
Also, make friends, because if you miss class and you have friends, you can always be like, hey, Johnny, what did we do in class today? And they can help give you points on what you learned and at a level that is maybe equivalent to your own, because they're a co-student with you, and that can also help you fill in gaps that you missed by talking with your classmates about what you learned or what they saw.
That's a beautiful segue to social and emotional challenges, because you say make friends. Oh, please walk. Go ahead. Can we get a round of applause for our director of the documentary, Compromise? He is the most humble, but he has done such an incredible job. This is Zach, y'all, and I just want to, just call him out. I know. Well, isn't it all about you? No, okay. But you bring up a really good point, Lance. You say make friends, like it's that easy, right? It's not that easy to make friends. It's not that easy to make friends when you're a kid. It's not that easy to make friends when you're an adult. And it's not that easy to make friends when you have a primary immune deficiency, right? Because one of the things you have to worry about is isolation. So tell me about the social and emotional challenges of making friends, keeping friends, putting yourself out there, feeling isolation, feeling different, frustrated, and missed opportunities.
I have something. Oh, you go.
No, Kirsty, you go first.
Fight it out.
You go first.
No, I like her. Okay. No, I have a little bit of a different perspective as a mom with a daughter. I have two little girls. One does not have PI, the other one does. And she is about to be 9 next week. And so she is just now getting to that time where you start realizing, I don't even want to say it because it's not true, but you feel like I'm different. What's going on? My friends are at school and I had to go to the hospital, or I had to do this. And so something that I have tried to keep in the front of my mind is make sure that she knows, do everything you can just like anyone else. You're not different. I have her in activities, and when I was growing up and dealing with the same thing, my mom always pushed me to do anything and everything. I was never made to feel like I wasn't capable or, just jumping into friend groups and trying different things. And I think that carried over to my work life, but now I'm trying to do it with my little one too. So yeah, get involved in anything you can.
In terms of, I guess, combating isolation, it can be very isolating to feel like you're the only person in the room that has something wrong with them and everyone around you is normal. I know growing up especially, it's very hard as a kid dealing with chronic illness because you feel as if you're being forced to grow up so quickly. You're forced to mature because you have so many challenges and burdens that are, not within your control. So when you do make relationships or find people that you connect with, do not waste time on those that don't value you or treat you correctly. Definitely try and find people who are incredibly supportive, those who understand your limitations, and make sure that you do not feel at any point as if you are a burden, because that is something I have struggled with a lot throughout school as well. I even saw that with my school nurses too. When I was first diagnosed and I would wear a mask during cold and flu season, they just told me, they're like, you shouldn't even be here at all. Like, why are you enrolled in school? And not only being around students who treated you differently because of a disability or chronic illness, but then being around adults who also did the same thing, it definitely reinforces that sort of mentality that you're not worth being in happy and stable relationships. So definitely do not waste your time with people who don't value you.
I love that advice.
Always remember, sometimes it is important to miss a school event for your own health, because if you're gonna go to a school event and it's going to wear you out even more, you already don't have the energy, all you're doing is hurting yourself, and that's not worth it. Go back to self-care, take care of yourself, because sometimes it's worth missing the opportunities to not have to miss prolonged amounts of school because you're now sick and unable to go to school.
That is great advice. Yeah, back to that self-care. And even and self-care even means the people who you surround yourself to, around. Who you surround yourself with is what I'm trying to say. And so that's a really good point you bring up, Vicki. You will always find your tribe. It may take a while, but you will find your tribe. And those people who are in your tribe will never make you feel like a burden. They will always support you. They will always lift you up, and you will find them, I promise you. If you haven't found them yet, it's just because they're out there waiting for you.
Or they're here.
Or they're here.
Yeah.
Or they're here. I'll plug IDF in a little bit, but they are here. So if you see another young adult and you think maybe they're the same age I am, don't be shy, because everyone here, some people here have never met anyone else with a PI before today. What a shame to feel like you are too shy to introduce yourself to someone who has the same exact experience as you do. Maybe not the same exact, but very similar. So put yourself out there, because this is one of the best places to find your tribe. So thanks for saying that.
Also remember, sometimes advocating for yourself in front of others helps others feel confident to advocate for themselves.
It's so true.
And like exactly like Lance was saying, like your struggles only make you stronger through PI. Like never think, I am my illness, I am CVID, it's my fault that I'm born this way. It's all, never think toward the negative sides of this. You were born with these problems, these obstacles, I guess challenges, yes, to make you better, to make you a better friend, to make you a better person, to make you more relatable, to make you be able to have this advice to share with other people, to be like, hey, that's really crazy that happened to you. Guess what? That happened to me, and we can get through it together. And I think keeping that sense of community and finding friends who support all aspects of your life, like Vicki said, and having 2 great friends, over 20 friends who are going to touch all your stuff and drink out all your drinks when you turn around. 2 people that you can really confide in and trust is way better than having all of these, sort of friends just to seem popular or something. It's not worth it. And you only deserve what, you don't deserve what you think you need sometimes. Because, your disease, no one deserves to know what you go through unless they establish that trust within you. No one deserves to know what struggles you face if they don't give you the respect that you deserve. If you're with someone and they're being really mean to you based on missing school or having an illness or, oh, she checks out all the time or, oh, she's always going to see the nurse, it will never be you'll never be entitled to be like, oh, well, these are all the things that I have wrong with me. That is your confidential information, and that's private and public to you based off how you would like that to be presented. So always kind of keep that in the back of your mind, that it's okay to say no, and it's okay to kind of shut people down and be like, this is my life too.
I have a question from the audience.
Hi, I'm a parent of a son with PI. He's only 12 now, but I thought I'd ask this. So I hear you guys talk about advocating for yourself and knowing your rights, and obviously that's super important. First, it's kind of a multi-part question, but are you guys aware of a single resource that kind of outlines your rights specifically to education, specifically with PI? Because ADA is very, very vast. It covers everything from, the way a sink is installed in a bathroom, right? So, but you guys, there's a specific set of needs for people with PI. Because I'm wondering too, you guys are talking about sharing, or technology. Maybe that's part of your right to have your own technology at a school. But as a parent, I wouldn't even know where to begin with getting those resources. I assume that it's fairly global across the U.S. because it's a federal law. And then I guess if there isn't a single resource, my last part of the question is, is that something that you feel like you guys who are tied in with IDF could develop a resource guide to where for that next, the people coming behind you in education that are going to go through the same struggles?
So I can answer part of that question. IDF itself has a great resource in the school guide, because it breaks down that ADA educational rights just to the educational rights. as well as your guidance counselor in your school will have all the information that you need to know pertaining to educational rights, as that works within 504, as well as your IEP, Individual Education Plan, and then there's an IFSP, which acronyms are escaping my brain, and as well, they are called different things in different states. So, but IDF has a great resource to help you get started with the parent and child school guide, which if we have hard copies of, and they're not that heavy, so it's suitcase friendly, right down in our Riverwalk registration. Thank you. That's it right there. So you can just pick that up at the Riverwalk. It has great information in there. I'm going to kick it back over to the panelists.
For me as a nursing student, even anytime I need a resource for relating to PI, even if it's accommodation, my first go-to is the Immune Disease Foundation, followed by my IG source, which is done by Takeda, which is one of IDF sponsors. They kind of are my go-to, and then sometimes if I need to have more medical data to kind of back up my request, then I'll go to like the NIH, but I always start at IDF. That's always my first go-to. And I'll plug in for IDF that if you have a question that you're not seeing an answer to, call the number that's on the IDF website, and they will connect you with somebody who does have that answer, whether it's another person my age that is in it, someone like Kat, or someone who's in the education side of it. There's always somebody that can answer your questions, so don't be afraid to reach out to IDEA and be like, hey, I need help. They'll find a resource for you and kind of help you save time.
I have a question back here.
Yeah, I really like what the person in the middle said about, sorry, Rachel, you said about not accepting no as an answer, but also saying what the issue is and how you trying to solve it, trying to get through a hard time. Because I guess there's some psychology about, like, if you say you have a problem, people might try and back away from you, but if you're looking for a solution and asking them for help, people show more empathy or try and help you out. I was just wondering if you've got an example where you've seen sort of true empathy from a professor or a friend that, you know, you've seen the best in people to help you out.
Yes, sir. I can definitely answer this personally. I had a event that happened to me quite recently. It was about a week ago. I am still enrolled in an online class for anatomy and physiology. I'm trying to kind of jumpstart my college career, and I have an online professor. And I noticed some of her stuff was out of order, and I had been pretty sick, and I was very stressed between the class and my illness, and all of these things were piling up. So as a student, through the app that she would contact me and submit all my work through, I would contact her and be like, hi, this is Rachel. I was just kind of wondering if this or that, you know, what do you want me to turn in today? What do I need to be doing? And just no response, getting to me at crazy hours of the night. And I was like, okay, well, obviously she's not taking the steps that she needs to, so maybe I can take the steps that I need to. So I called the campus, and I went, and I called the campus, and they were like, oh, just email this person. And sometimes that's not really the best option, because you have to think as far as directors or anyone who's in charge of something. They get lots of emails, they get lots of phone calls, and it can very easily be accidentally brushed off, especially if they can't really connect to you on that personal level of like, is she just griping about this instructor because she doesn't like them and they have too much work? Is she even a good person? Does she even attend class? So I definitely think it's better to like go in person and like share your story with someone. I had went to see the Dean of Science, and he wasn't in, so I was transferred to the Dean of the campus. And he was very, very sweet and very kind, and he showed, like you said, the just most pure part of himself, and he was like, you know, I see what you're going through, I understand your struggles, I will not only talk to this professor, but I will extend this due date on this test because it was a technical error and you were sick, which shouldn't even be related because of the issue. But and he was like, but I just want to let you know, like, they support and they're part of my campus and they represent me and who I represent. So if they're treating you bad, that's making me look bad. And he was like, I would never want that for my campus. I would never want that to be your experience with my school. He was like, so I always want the best for you. And he was honest. He was like, I am the dean of this school. He was like, I have 100 people who work underneath me. I can't see how each person is working, but whenever you bring this up to me, it's a lot easier for me to kind of talk to them and get them to fix their ways. He had actually told me that multiple people had came in that day with the same issue, and he said that me coming up to him and kind of relaying that back to him really made everything easier.
Deans and employers can only vet the teachers so much. It really takes students that are under their direction and education to be like, hey, this is what's happening with this professor, for the dean or whoever it is to be like, okay, this isn't an educator that I need in my department. And that's not something they can always figure out in the interview process.
Well, we are running very close to our end of time here, but I do want to talk about the upside, the resilience. Dealing with a chronic illness can build resilience. It goes back to what Rachel was saying earlier about, you're presented with these challenges, and what are you going to do with these challenges? Are you going to make lemonade? Are you going to make lemon meringue? Or are you just going to stare at the lemons, right? And I cannot begin to even tell you about the resilience that's not only on the stage, but like right here in the audience. Kids that I have met throughout the last 2.5 years with my time at IDF have been the most resilient people I have met. So there's many ways to build resilience, but it goes back to building that strong support system. And advocacy, I already let you guys know that that's one of my favorite words. And each one of the panel members advocate every day in their own life. Just really quickly, give me one example of how you do advocate for yourself and your PI community.
Oh gosh, I gotta go first. One example. Do I really have to go first? I don't know.
I can do it.
Yeah, just shoot it out.
I think, honestly, the easiest way to advocate for PI is being able to share your story. And I know that it can be scary and it can be hard to talk to someone with PI or without PI. And they'd be like, hey, like, I noticed you've been sick a lot. Or they've been like, hey, I've been sick a lot. And being able to share what you've gone through and your struggles and give them advice and kind of connect with them. And I think, honestly, connection is the best part of advocation. It's because when they know what you're going through and they can relate to you, it's going to make the whole process of them understanding you so much better.
So true.
And like going with having the two friends, going with having the two friends instead of 20 fake friends. When you don't feel good, you're not going to want to be very communicative. So find the one that you can send, one or two people that you communicate with well that can help you, and then you get the resources you need. And that's an advocation for yourself of like, okay, I know you're going to help me, and I don't have to spend a bunch of energy that I don't have when I'm not going to get the resources I need back.
Speaking of resources, we have tons of resources for young adults and teens right at IDF. So please do check out our website for such resources as the school guide and the young adult handbook, as well as join many awesome discussions just like this one at our YA Get Connected group at events.primary.org, as well as for the teens and preteens in the audience. We are planning our Teen Escape Weekend 2025. I can't disclose the location as of now, but keep tuned for more details. And thank you for joining us today, and thank you for participating and sharing your own stories. Please do me the favor of, if you see someone that you don't know, it's only a friend you haven't met yet, so please introduce yourself to them. This right here is the greatest community you guys will ever find. So enjoy the rest of your PI conference. Thank you. Give a round of applause to our panelists, please.
You can also walk up to any of us and we'll talk to you one-on-one as
Yeah,
well.
they're obligated. They're not obligated. They would love to speak to you. This is one of the things they do out of pure joy. They love to talk to other kids because they know what it's like. So please do talk to any of the members of REI.
And as Lance said, if any of y'all feel like kind of scared, I know it can kind of be scary to be like, hey, I have a question, you know? I don't know if y'all watched that Inside Out movie, but embarrassment, your little guy's like this right now. But if y'all just, like he said, just come up to us, talk to us personally, and we'll be glad to share anything we can with you. And if we can't help you, we will direct you like our amazing Miss Kat or one of her amazing faculty and friends who can answer your question, or one of her amazing